Greetings, I'm Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, and with this presentation I'd like to welcome you to the January 2014 issue of the journal. In this issue, we celebrate the Sesquicentennial of Mayo practice in Rochester, Minnesota and beyond. As I describe in this editorial, Mayo Clinic traces its date to January 1864, when William Worrall Mayo started a private practice in Rochester, Minnesota. In the 1890s, he was joined by his sons, William James Mayo and Charles Horace Mayo, who helped expand the practice by helping to hire other physicians into the practice and bring in other experts, nurses, administrators, technicians, and others who would help the practice grow over the ensuing years. They were instrumental in the growth of St. Mary's Hospital 1 mile west of downtown Rochester, and also in buildings in Rochester City proper, in which they improved the logistics and interactions among staff members and physicians. And they also developed libraries, systems of communications, a type of medical record that would be durable, and other foundations that would form the basis of what is today the largest private, not-for-profit, multi-specialty group practice in the world. Today, Mayo Clinic has more than 57,000 employees and has clinical, educational, and research activities that reach worldwide. It is truly a marvel of the modern world. Mayo Clinic Proceedings is proud to be a part of this sesquicentennial celebration, as I have outlined in my January editorial. As a part of this celebration, we have begun by changing the facade of the print journal for the entirety of 2014. There will also be other design elements inside the print journal that will identify features that are dedicated solely to the celebration of the sesquicentennial. Among these, the January issue contains a commentary by Dr. Carrie Olson and Mr. Matt Dacey that talk about the sesquicentennial and provide an overview. In February, Dr. Lynn Berry of Texas A&M University and Mayo Clinic's Dr. Ken Seltman will provide an article on the enduring legacy of the Mayo Clinic culture. The March issue contains a commentary by Dr. Mark Warner, Executive Dean of the College of Medicine, that talks about Mayo Clinic's broad-reaching education programs worldwide. And in the April issue, President and CEO of Mayo Clinic, Dr. John Noseworthy, will talk about the philosophy and activities of Mayo Clinic that will pave the way for its progress and innovation well into the future. We hope you enjoy these features in the print journal. There also will be other features on the journal's website. For example, a website historical vignettes section will outline the contribution of many Mayo departments and divisions and the innovations they have introduced over the years to help fulfill Mayo's mission to improve the health care of patients worldwide. There also will be a Mayo Clinic Proceedings legacy section that outlines two components. One, the development and growth of Mayo Clinic Proceedings as a journal, and secondly, articles printed in Mayo Clinic Proceedings that outline major discoveries that in turn help change healthcare practice worldwide. All of these elements will be collated in a special segment of the website's homepage, and this area will also contain a link to the Mayo Clinic Sesquicentennial Celebration website proper. In aggregate, these elements of Mayo Clinic Proceedings in 2014 are intended to entertain and educate those regardless of their familiarity with Mayo Clinic or the proceedings. Also in my January editorial, I will discuss how, a decade and a half ago, Mayo Clinic Proceedings leadership studied the culture of Mayo Clinic and the innovations that helped make the clinic what it is today to redesign the peer review process, the print journal, and the website, such that today Mayo Clinic Proceedings is one of the world's largest and most influential medical journals. In closing, I would like to thank you for your ongoing support of Mayo Clinic Proceedings, and thank you for joining the journal in this celebration of 150 years of Mayo practice. We hope you can learn from the information provided not only in the print journal but also on the website, and incorporate many of the values and philosophies that we described this year as we all seek to improve the well-being of those patients who trust their care to us. Collectively, we hope we can use this celebration of Mayo's Sesquicentennial to reaffirm the Mayo Clinic primary value. The needs of the patient come first. Thank you. We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.